Hi, my name is Faith Lee, and my study is the effects of self-selected music and binaural beats on dental anxiety.
Dental anxiety is one of the most significant factors that leads to avoidance of dental care, and 60% of patients suffer from this anxiety. This creates a vicious cycle where dental anxiety leads to avoidance of dental care, which leads to poor oral health care, which leads to feelings of guilt, shame, and inferiority, which circles back to dental anxiety. Previous studies have looked to find a non-invasive audio technique that can lower dental anxiety. However, no study was found that establishes a superior audio technique, and this is what my study seeks to do. Based on a study by McCall and Mallet, a patient's perception of pain can be decreased when the patient is distracted from an unpleasant stimulus. In this study, the distraction is the music and the unpleasant stimulus is the dental procedure. Dental treatments have been shown to affect cardiovascular responses by increasing heart rate and blood pressure. Dowd and Davis show that the type of music chosen, whether experimenter selected or patient selected, can decrease self-reported anxiety. One audio technique is called binaural beats. It works by playing a different frequency in each ear. For example, 10 Hz in one ear and 15 Hz in the other ear. The difference, 5 Hz, would cause the brain waves to mimic this frequency. Neurons throughout the brain begin to send electrical messages at the same rate as the binaural beat. Low-frequency brainwaves, such as theta waves, are related to relaxed feelings. We have these types of brainwaves when we are about to drift off into sleep. Another study demonstrated that listening to binaural beats during a dental procedure significantly lowered anxiety on a visual analog scale. Researchers have also suggested that one's musical preference is important when examining the anxiety-reducing effects of music because of individual preferences differing across generations and cultures, which is why I chose to measure self-selected music as well. However, studies have shown that music with faster tempos can actually increase one's breathing and heart rate. Therefore, self-selected music may not be as efficient as binaural beats. This led me to create my first two hypotheses, which state patients listening to low-frequency binaural beats, which are theta waves, and self-selected music during the treatment will report lower anxiety levels, have lower blood pressure, and have a lower heart rate than patients listening to no music. And patients listening to binaural beats will report lower anxiety, have lower blood pressure, and have a lower heart rate than patients listening to self-selected music. 39 participants were randomly divided into one of three groups upon arrival: binaural beats, self-selected, or control. The patients' genders were about equal between males and females, and their ages ranged from their 20s to 80s. Before examination, they were asked to complete the Modified Dental Anxiety Scale, which measured their baseline dental anxiety. It asked questions like, if you were to go to your dentist for treatment tomorrow, how would you feel? And they would select from 1, not anxious, to 5, extremely anxious. Their heart rate and blood pressure were also recorded. They listened to their assigned music using stereo headphones, which ensured that different sounds were coming from each side, using an iPhone given to them during the whole examination. Their heart rate and blood pressure were recorded again in the middle of the procedure. After the examination, the participants completed the patient rating of anxiety question, which asked, how would you describe your anxiety during the dental treatment today, on a scale of 1, calm and relaxed, to 7, extremely tense and upset. Heart rate and blood pressure were also recorded for the last time. A one-way ANOVA revealed that binaural beats and self-selected music significantly lower the patient's heart rate from pre-examination to during the examination with a p-value less than 0.001. The binaural beats show the greatest decrease in heart rate with a mean decrease of 8 beats per minute. The decrease between the two groups was significant according to a post hoc, which reported a significance of 0.02. This may be due to the fact that binaural beats reduce activity in the neuroendocrine and sympathetic nervous systems, which decrease heart rate, like Thomas et al. Found in 2013. Binaural beats might have been more effective because certain kinds of music with faster tempos that the patients could have selected can actually increase breathing rate and therefore increase heart rate, as described by Crisanti in 2015. Another one-way ANOVA showed the change in heart rate from during the examination to post-examination. From this time interval, binaural beats was the only music type effective at lowering heart rate. This is likely due to the fact that low brainwaves, like theta waves, can lower heart rate, as stated by Weiland et al. In 2011. There is no effective music type on systolic or diastolic blood pressure throughout the examination. As you can see from the chart, the blood pressure remained approximately the same in each group. I've yet to find why heart rate changed and blood pressure didn't, and I'm still investigating possible explanations. I theorize that these results occurred because heart rate is easier to change than blood pressure when presented with a stimulus. Lastly, music had no effect on self-reported anxiety that was measured after the examination. In addition, you can see from the graph that their pre-examination dental anxiety was about the same. This might be due to the fact that there is a condition association between dental procedure, which is the stimulus, and anxiety, which is the condition response, as described by Carter et al. In 2014. It may take several dentist visits while listening to music to eliminate this association. One limitation of my study was the limited number of participants. A larger sample size could yield more significant results. In addition, the dental procedures were not all exactly the same length, so the time listening to music was varied. In the future, I plan on looking at the effects of specific types of music genres on dental anxiety. I would also like to measure dental anxiety from salivary cortisol, which indicates stress. Binaural beats and self-selected music significantly lowered patients' heart rate, but binaural beats were more effective. None of the music types lowered blood pressure or self-reported anxiety. Patients that suffer from dental anxiety can listen to binaural beats on their personal device, or dental offices can offer the option of listening to this music to lower their heart rate. However, the dental anxiety cycle is not truly broken until the patient consciously feels less anxious, and this might take multiple dental visits to be successful. Overall, the binaural beats and self-selected music were effective at lowering heart rate, but future studies are still needed to find a way to make the patients feel less anxious. The use of these audio distraction techniques can possibly be used in other anxiety-provoking medical situations, maybe even for kids that are too scared to get a vaccine. Thank you for listening to this presentation. I hope you enjoyed.